Welcome back to Easy Medicine. Today, we're breaking down 4 high-yield biochemistry cases, turning difficult pathways into concepts that actually make sense for Step 1 in clinical learning. Let's begin. Case 1. A foreign antigen recognized at the cell surface by cytotoxic T lymphocytes triggers rapid programmed cell death. The question is, which molecules act as the final effectors of this process? The correct answer is Caspases. Cell death occurs mainly through 2 mechanisms, necrosis and apoptosis. Necrosis is uncontrolled, caused by cellular injury, whereas apoptosis is an organized process initiated by the body. Apoptosis plays a critical role in eliminating unnecessary or abnormal cells while maintaining tissue homeostasis. Tumor cells, activated immune cells, and virally infected cells commonly undergo apoptosis. Once these cells die, their remnants are removed by macrophages without triggering significant inflammation. Apoptosis follows 3 major stages. First is initiation. This can occur through either the intrinsic mitochondrial pathway or the extrinsic receptor-mediated pathway. Second is regulation. The intrinsic pathway is controlled by the BCL2 family of proteins. Third is destruction. At this final stage, both pathways converge and activate caspases. Caspases are proteolytic enzymes that serve as the executioners of apoptosis. They contain cysteine residues and cleave proteins at aspartic acid sites, leading to controlled cellular breakdown. More than 10 caspases have been identified and are classified into initiator and effector caspases. Initiator caspases activate effector caspases, and effector caspases ultimately degrade essential cellular components, resulting in programmed cell death. Case 2. A 5-day-old newborn is diagnosed with hyperphenylalaninemia and is started on a phenylalanine-restricted diet with tyrosine supplementation. The parents receive extensive counseling and follow-up is arranged. Months later, laboratory studies show normal serum phenylalanine levels. However, the infant develops neurologic abnormalities, including axial hypotonia, and further evaluation reveals elevated prolactin levels. The question is, which enzyme deficiency most likely explains this condition? The correct answer is Dihydropteridine reductase deficiency. Elevated phenylalanine in newborns is most commonly caused by phenylalanine hydroxylase deficiency, known as classic phenylketonuria, or PKU. Treatment with dietary phenylalanine restriction usually prevents neurologic complications. However, this patient continues to develop neurologic symptoms despite normalization of serum phenylalanine. This suggests a less common defect involving tetrahydrobiopterin, or BH4. BH4 is an essential cofactor for aromatic amino acid metabolism. It is required not only for conversion of phenylalanine into tyrosine, but also for synthesis of important neurotransmitters. Deficiency of BH4 results in impaired production of dopamine and serotonin, explaining progressive neurologic dysfunction and elevated prolactin levels. Dihydropteridine reductase is responsible for regenerating tetrahydrobiopterin into its active form. When this enzyme is deficient, patients develop hyperphenylalaninemia together with neurotransmitter deficiency, making dietary treatment alone insufficient. Case 3. A 50-year-old man presents with 3 months of fatigue, exertional dyspnea, early satiety, and upper abdominal discomfort. Physical examination reveals splenomegaly without lymphadenopathy. Laboratory testing shows anemia, thrombocytopenia, and marked leukocytosis. Reverse transcription polymerase chain reaction is used to confirm the diagnosis of chronic myelogenous leukemia. The question is, what is most likely detected by this test? The correct answer is messenger RNA containing both BCR and ABL exons. Reverse transcription polymerase chain reaction, or RT-PCR, is a molecular technique used to detect and quantify messenger RNA. Unlike standard PCR, which amplifies DNA directly, RT-PCR first converts messenger RNA into complementary DNA using reverse transcriptase. This complementary DNA is then amplified through conventional PCR. Because cDNA reflects the processed messenger RNA sequence, it contains expressed exons and untranslated regions. Chronic myelogenous leukemia results from a chromosomal translocation that fuses the BCR gene on chromosome 22 with the ABL gene on chromosome 9, creating the Philadelphia chromosome. This produces the BCR-ABL fusion gene, which encodes a constitutively active tyrosine kinase. The abnormal kinase continuously stimulates cell division and increases genomic instability. RT-PCR detects messenger RNA transcribed from this fusion gene, making it a highly sensitive diagnostic method for identifying chronic myelogenous leukemia. Case 4. Researchers studying the relationship between fructose consumption and cardiovascular disease follow a cohort of healthy young adults over time. During analysis, one participant is found to excrete unusually high amounts of fructose in the urine, despite only moderate fructose intake. Further evaluation identifies an inherited defect in fructose metabolism, yet the patient remains completely asymptomatic. The question is, which enzyme allows continued fructose metabolism despite this defect? The correct answer is hexokinase. Fructose is primarily obtained from fruits and dietary sweeteners such as sucrose and high fructose corn syrup. It is absorbed in the proximal intestine through the GLUT5 transporter. Normally, fructose metabolism begins in the liver, where fructokinase converts fructose into fructose 1-phosphate. Aldolase B then converts fructose 1-phosphate into dihydroxyacetone phosphate and glyceraldehyde, which ultimately enter glycolysis. This patient has fructokinase deficiency, also called essential fructosuria, an autosomal recessive disorder that is typically benign and asymptomatic. In the absence of fructokinase, hexokinase compensates by phosphorylating fructose into fructose 6-phosphate. This intermediate can directly enter glycolysis or be redirected into glucose metabolism, glycogen synthesis, or the pentose phosphate pathway. This compensatory pathway explains why patients with essential fructosuria usually remain healthy despite urinary fructose excretion. If this video helped simplify biochemistry, subscribe and continue building your medical foundation with easy medicine. See you in the next high-yield review.